Hello, everyone. Food composition data is the backbone of nutrition science and food policy. Whether you're a researcher, dietitian, or simply someone interested in healthy eating, understanding what's in our food is essential. This information helps us make informed choices, guides public health recommendations, and supports food safety and security. In this video, we'll explore what food composition data is, why it matters, and how it's used across the world. Let's begin by understanding the roots and importance of this vital data. Food composition data is essential for food-based nutrition and agriculture. It's used to study the relationship between diet and health, food safety, and food security. High-quality data supports researchers, nutritionists, the food industry, health practitioners, policymakers, and consumers. Databases focus on foods that are commonly consumed or nutritionally important. Many countries produce their own datasets, and some are available online. However, food composition can vary, and users must be aware of its limitations when calculating nutrient intake. The study of food composition dates back over 200 years. Early records include analyses of mineral waters and vegetables in the 19th century. The first modern food composition tables appeared in Germany in 1878 and North America in 1896. In the UK, interest grew during World War I, leading to the first edition of the Composition of Foods. Since then, food composition data has evolved into comprehensive databases, supporting nutrition science and public health worldwide. Many countries now produce national food composition datasets, often available online and regularly updated. In Europe, the Eurofur network helps standardize and share data. However, developing countries may lack up-to-date or comprehensive databases, often relying on international sources like the USDA. The International Network of Food Data Systems, INFOODS, works to improve global data quality and availability, maintaining an inventory of resources and supporting countries in building their own datasets. Food composition data serves a wide range of users: researchers, policymakers, the food industry, health professionals, and consumers. Each group has unique needs. Researchers require detailed data for studies, while policymakers use it to inform guidelines. The food industry relies on it for product development and labeling. Health practitioners use it to advise patients, and consumers benefit from accessible information to make healthier choices. The diversity of users makes it challenging to provide data that meets everyone's needs. National food composition datasets are crucial for dietary monitoring and food safety assessments. For example, the UK's Nutrient Databank supports the National Diet and Nutrition Survey, helping to track population nutrient intake. Similar programs exist worldwide, using food composition data to assess food security and safety. Variability in datasets can affect nutrient intake estimates, potentially leading to errors in public health assessments. Accurate data is vital for identifying nutrient deficiencies or excesses in populations. Epidemiological studies depend on food composition data to link diet with health outcomes. Researchers need representative data for all nutrients in foods consumed by study populations. Standardized datasets and data sharing between countries improve research quality. However, using data from other countries can introduce errors, as local foods may differ in composition. Accurate, localized data is essential for reliable research findings and for developing effective nutrition interventions. The food industry uses composition data to develop products that meet nutrition policies, such as reducing salt, sugar, or unhealthy fats. Nutrient labeling is now mandatory in many regions, helping consumers make informed choices. Regulations like the European Food Information Regulation require detailed nutrient information on packaged foods. Branded food data is increasingly included in databases, though maintaining up-to-date information is challenging due to frequent product changes. Agricultural practices are influenced by nutrition policy, with food composition data guiding the development of crops with higher micronutrient content. For example, cereal crops may be bred for increased iron, zinc, or vitamin A. It's important that databases reflect the biodiversity of plant-based foods and track trends in crop production. This ensures that nutrition policies are based on accurate, up-to-date information about the foods people actually consume. Health practitioners and policymakers rely on food composition data to shape nutrition guidelines and public health strategies. National databases should include foods high in micronutrient and those consumed by specific groups, such as children or the elderly. As the food industry changes products, databases must be updated so practitioners can provide accurate advice. Reliable data ensures that health recommendations are relevant and effective for diverse populations. While consumers may not use raw food composition data directly, they benefit from information presented in accessible forms, such as nutrition labels and mobile apps. As interest in diet and health grows, more apps use food composition data to help people monitor their nutrient intake. These tools are especially useful for education, supporting healthier choices for individuals and families. Developers should ensure their data sources are transparent and reliable. Ideally, food composition databases would be comprehensive, covering all foods and nutrients. However, high analysis costs and limited resources mean most databases focus on commonly consumed foods and key nutrients. Foods are prioritized based on national consumption statistics and the needs of specific groups. The concept of key foods helps identify those that contribute most to population nutrient intake. Collaboration among researchers, government, and industry ensures that priorities reflect real-world needs. In addition to generic foods, data for branded products is increasingly available, especially in Europe. Regulations require nutrient content on labels, and this information is often accessible online. Databases must be regularly updated to include new foods and reflect changes in product composition. Priorities for updates are set based on food type or nutrients of interest, ensuring that the most relevant data is always available for users. Accurate food description is essential for meaningful data. Differences in preparation, processing, and even packaging can affect nutrient content. Systems like Langua L and Food X2 use facets to describe foods in detail, including source, part consumed, processing, and more. These systems help standardize data and make it easier to compare foods across countries and studies. Clear descriptions ensure users know exactly what each data point represents. Faceted systems like Langua L and Food X2 break down food characteristics into multiple categories, such as source, part, processing, and packaging. This approach allows for precise identification and comparison of foods, even when names are similar. For example, a vegetable can be described by its species, part consumed, cooking method, and packaging. These systems are widely adopted in Europe and help harmonize food composition data internationally. Food composition databases aim to include all nutrients and non-nutrient components important for health. However, analyzing certain components, like vitamins and bioactives, can be expensive and complex. Most datasets focus on core nutrients such as water, protein, fats, carbohydrates, and key minerals and vitamins. National priorities and health concerns influence which components are included. Some nutrients are calculated from others, while others are measured directly. Correct identification of nutrients is crucial. Different systems, like INFOODS and Eurofer, use unique identifiers and methods to ensure accuracy. INFOODS includes analytical methods in its identifiers, while Eurofer separates method information. This helps users understand how data was obtained and ensures that values are comparable across datasets. Some nutrients, like protein and energy, are calculated rather than measured directly, using established conversion factors. UK Composition of Foods dataset includes a wide range of nutrients: water, protein, fats, including saturated, monounsaturated, polyunsaturated, and trans fats, carbohydrates including sugars and starch, dietary fiber, minerals, and vitamins. Some nutrients, like phytosterols and organic acids, are only available for selected foods. This comprehensive approach ensures that users have access to detailed information for dietary planning and research. Bioactive compounds are natural substances in foods that impact health, such as vitamins, phytosterols, and flavonoids. While some are included in standard databases, many are found in specialist datasets or scientific literature. Interest in bioactives is growing, especially for their role in preventing chronic diseases. Databases like EBASIS and Phenol Explorer provide detailed information on bioactive content in plant-based foods, supporting research and dietary recommendations. Bioactive compounds include glucosinolates in broccoli, capsaicinoids in peppers, lignans in grains and legumes, and various flavonoids in fruits and vegetables. These compounds are linked to health benefits, such as reduced risk of chronic diseases. Specialized databases collect and evaluate data on these substances, ensuring that researchers and health professionals have access to reliable information for dietary guidance. The EBASIS database compiles data on bioactive substances in plant foods, including both composition and bioeffects. It covers over 750 compounds in more than 250 food plants, using strict quality criteria. Phenol Explorer focuses on polyphenols, offering data on over 500 compounds in 400 foods. Both databases are built from peer-reviewed scientific literature and provide valuable resources for researchers and nutritionists. Food composition isn't just about nutrients. Foods can also contain contaminants from the environment, production, or packaging. These substances, like heavy metals or dioxins, pose health risks if consumed in excess. Many countries monitor contaminants and set maximum intake levels. The EU and World Health Organization maintain databases tracking contaminants in foods, supporting risk assessments and public health policies. European Food Safety Authority, EFSA, collects data on chemical contaminants from member states, using it for scientific opinions and public reports. The World Health Organization's GEMS Food Database contains over 400,000 analytical results on contaminants in foods from more than 40 countries. These resources help identify risks and inform policies to protect public health worldwide. Food supplements are increasingly important sources of nutrients and bioactives, especially in developed countries. National organizations monitor supplement use, but data is not always publicly available. The USDA and other agencies publish databases on supplement ingredients, supporting dietary surveys and research. These databases help track nutrient intake from both foods and supplements, ensuring a complete picture of population nutrition. The USDA's Dietary Supplement Ingredient Database and the National Institutes of Health's Label Database provide detailed information on supplement products in the USA. Australia and some European countries also maintain supplement databases, though coverage varies. These resources are essential for understanding total nutrient intake, especially as supplement use grows among different population groups. Food composition data comes from various sources: direct analysis of food samples, imputed values based on similar foods, calculated values from recipes, and borrowed values from other countries' databases. Direct analysis is preferred but expensive. Imputed and calculated values help fill gaps, while borrowed values are referenced to their original source. Transparency about data sources is crucial for users to assess reliability. Data quality depends on factors like food description, component identification, sample collection, analytical methods, and laboratory performance. National datasets are compiled by experts and judged to be reasonable estimates. Collaborative projects like Eurofer have developed quality frameworks and tools to harmonize data across countries. Documentation and traceability of data sources are essential for transparency and user confidence. Direct analysis of food samples is the gold standard for food composition data. Ideally, multiple representative samples are analyzed to provide accurate statistics. However, due to cost, composite samples are often used, combining several subsamples into one. Analytical data may also come from scientific literature or manufacturer data, provided it meets quality standards. This approach ensures a broad range of foods and nutrients are covered. Imputed values are calculated from similar foods or different forms of the same food, such as cooked versus raw. Some nutrients are calculated from others, like protein from total nitrogen. Calculated values often come from recipes, adjusting for cooking losses. While these methods help expand data coverage, they may not always match foods prepared by individual consumers, so users should interpret them with care. When data is unavailable locally, compilers may borrow values from other countries, food composition tables. These values are referenced to their original source and may be adjusted to match local food characteristics. Borrowed data helps fill gaps, especially in developing countries, but users should be aware of potential differences in food composition due to regional variations. To ensure users can evaluate and trust food composition data, published values should be traceable to their original source. Most European databases provide documentation on data sources, sampling, and analytical methods. The UK's 2015 dataset, for example, includes main data sources and years of analysis for each food. This transparency supports informed use and further research. Quality frameworks, like those developed by Eurofer and the USDA, help standardize and assess the reliability of food composition data. These systems evaluate factors such as sampling, analysis, and documentation. Training and guidelines are provided to data compilers, ensuring consistency and high standards across national and international datasets. This harmonization is key for global nutrition research and policy. Dietary simplification has reduced the variety of plant species in our diets, impacting nutrition and food security. Biodiversity in nutrition promotes diverse, sustainable diets and can help address nutrient deficiencies. Nutrient content can vary greatly between varieties of the same species. Databases often focus on common commercial varieties, but specialized resources track the nutritional value of less common foods, supporting biodiversity and better health. The FAO-INFOODS Food Composition Database for Biodiversity compiles data on underutilized crops and varieties. This resource helps researchers and policymakers understand the nutritional potential of diverse foods, supporting strategies for food security and improved nutrition. Including biodiversity in food composition data is essential for promoting sustainable diets and addressing global health challenges. Food composition data is invaluable, but it has limitations. Natural variations in foods mean reported values are estimates, not exact figures. Factors like plant variety, origin, season, and processing all affect nutrient content. Processed foods can vary due to manufacturing changes. Regular updates are needed to keep data relevant. Users should treat missing values with caution and understand that bioavailability is not usually considered. Nutrient content in foods can vary due to natural and extrinsic factors. For example, the protein content of rice can range from 5 to 14 grams per 100 grams, and the carotenoid content of sweet potatoes can differ by a factor of 200. Such variability highlights the importance of using food composition data as estimates, not absolutes. Users should be aware of these differences when interpreting data. Processed foods present additional challenges for food composition data. Manufacturers may change ingredients or processing techniques, leading to differences in nutrient content. Public health initiatives often drive changes, such as reducing salt or fat. Databases must be updated regularly to reflect these changes, but it's inevitable that some values will become outdated over time. Missing values in food composition data should not be treated as zero. While major nutrients are usually reported, some vitamins and minerals may be missing for certain foods. Treating missing values as zero can lead to underestimating nutrient intake. Users should carefully check food names and descriptions to ensure they're using the correct data for their needs. Comparing food composition values across datasets or over time requires caution. Differences in sampling, analytical methods, and calculation units can all affect results. Foods with similar names may not be identical. Users should consider these factors when comparing data and interpreting trends in nutrient intake or food composition. Estimating nutrient intake relies on both food composition data and accurate records of food consumption. The accuracy of intake estimates depends on the quality of both datasets. Limitations in dietary assessment methods, such as portion size estimation, can affect results. Users should be aware of these challenges when using food composition data for research or dietary planning. Food composition data must be updated regularly to reflect changes in food production, processing, and consumption patterns. Public health initiatives, new products, and changes in agricultural practices all influence nutrient content. Ongoing investment in data collection and analysis is essential to maintain the relevance and accuracy of food composition databases. International collaboration is key to improving food composition data. Networks like Eurofer and INFOODS bring together experts to harmonize methods, share data, and develop quality standards. These efforts ensure that food composition data is reliable, comparable, and useful for global nutrition research and policy development. As technology advances, food composition data will become even more detailed and accessible. Mobile apps, online databases, and integration with health monitoring tools will empower consumers and professionals alike. Continued research into bioactive compounds, contaminants, and food biodiversity will expand our understanding of nutrition and health. The future of food composition data is bright, with new opportunities for innovation and impact. Food composition data is a foundational tool for nutrition science, public health, and the food industry. It supports research, informs policy, and helps consumers make healthier choices. While there are challenges and limitations, ongoing collaboration and investment are improving data quality and coverage. By understanding how food composition data is collected, used, and maintained, we can all make better decisions for our health and well-being. Thank you for joining us on this journey through the world of food composition data. Whether you're a researcher, health professional, or simply curious about what's in your food, understanding this data empowers you to make informed choices. As food systems evolve, so too will the data that supports them. Stay curious, stay informed, and remember, the story of food is written in its composition.